Well, taking a look at your health watch, about 6 million Americans are set to fly during the Thanksgiving holiday. That's according to AAA. The U.S. may be heading into its second severe flu season in a row, driven by a mutated strain called subclade K. Did I say that right, Dr. Fish?
Did.
Okay, good. It might not be fully covered in this year's vaccine. So joining us now is Dr. Lindsey Fish from Denver Health. We were just talking about the sickies coming home from school.
They are.
They're here and they're ready for us. Okay, so Thanksgiving is next week. We don't want to be sick, but it seems like everybody is sick. So the CDC says flu cases are low right now, but they're quickly rising. What should people know before they head out?
Well, we always see an uptick in influenza after the travel of the holidays because people get together. And we are a little bit worried this year because there's this new H3N2 strain that unfortunately was not included in our flu vaccines this year. So, you know, people get sick because they're spending a lot more time around other people. So it's in airports, it's in buses, we're around lots of people and we're traveling between different places. So people who travel then bring it to relatives who aren't around so much, just as we were talking about. Yeah. And even people with mild symptoms can spread stuff. And so really it's about taking some preventative measures.
Okay, so what are those preventative measures that we can try to keep ourselves flu-free?
Yeah, step one is absolutely get your flu shot. Although this may not be a perfect match, we know that there is benefit to getting the flu shot. It is safe. We recommend it for everyone. Second is simple stuff. Hand washing, hand sanitizing. If you're going on the plane, wipe down the trays and the handles of the ride shares, the remote controls in hotels. Let's wipe that down. And really then just sort of do your part. If you don't feel well, stay away from other people.
Yes, I feel like we all have FOMO, so that is the key thing. If you don't feel good, don't go. The rest of us don't want it.
Absolutely.
Yes. Okay, so maybe you're hosting Thanksgiving dinner. How do you maybe help prevent it from spreading in your own home?
So the first thing is things to say up front. So as you mentioned, say up front, if you're coming, please get vaccinated. If you don't feel well, please stay home and create a virtual option for those who are not able to make it.
Smart, yeah.
We certainly recommend things like hand washing, hand sanitizer, make everybody wash their hands before you dish up. One trick I always recommend is to use different spoons for each person, so you're not using the same spoon one person after another as the same surface that you're touching, really easy to spread germs. If you're worried about somebody in your family who's maybe higher risk, a really young child, an older adult, somebody with medical conditions, find a way to create some social distancing for them. And if you're going to a place where the weather is good, you can open windows or use air purifiers to sort of keep the air circulating.
Yes, get outside and maybe go for a walk too. Okay, so what misconceptions do people have about the flu vaccine normally?
So first is that it's not safe. The flu vaccine is absolutely safe. We recommend it for everyone, and it does help. Every year you've got to get a flu vaccine. Last year's isn't going to help you this year. And even though there is some concerns about different strains, this year's will help prevent you from having severe illness. And that's the key. We really want to keep people out of the hospital and severely ill, and that's what the flu vaccine does. It keeps you from getting severely ill and hospitalized.
Okay, Dr. Fish. Well, hopefully we all stay okay there before Thanksgiving. We'll be back. Well, not next week. It's Thanksgiving on Thursday, but we'll see you here very soon to talk more about health heading into the holidays, the next holidays.
Absolutely.
Yes.
Such great tips as always. Thank you, ladies. So